We also continue to urge all eligible South Carolinians who have not yet been vaccinated against COVID-19 to do so as soon as possible. We know that masks and vaccines are safe and effective and can keep our kids and teachers safe in our schools based on these evidence-based studies. In fact, a recent CDC report of 3 studies highlighted how effective mask wearing in schools. Populous counties were 3.5 times more likely to have COVID-19 outbreaks if they did not have a mask requirement at the start of school, compared to the schools that did require universal masking on day 1. Another study found that during the 2 weeks following the start of school, the average change in pediatric or children's COVID-19 case rates was lower among counties with school mask requirements, about 16 cases per 100,000 people per day, compared to the counties without school mask requirements, which had about 35 cases per 100,000 people per day. The third study looked at COVID-19 related school closures and found that despite an estimated 1,801 school closures so far this school year, 96% of public schools have been able to remain open for full in-person learning. Each of these studies and their findings highlight the benefits of masking in schools, and we hope our schools exercise the ability to protect their students and teachers and staff. I also want to cover some other news by first recapping our statement on Pfizer's work to offer vaccinations for ages 5 to 11-year-olds. We certainly support these efforts, but it is too early in the process to provide any specific details. Pfizer needs to gain the emergency use authorization from the FDA and the clinical guidelines for use from the CDC via their Advisory Committee on Immunization Practices. We will continue to monitor this evolving situation in hopes that the vaccine will be made available for younger age groups as soon as possible. Lastly, I want to clarify the CDC's guidance on boosters from late last week. This can be a bit confusing, but I'll do my best to simplify it. The CDC's recommendation is for high-risk populations to get a booster shot of the Pfizer vaccine at least 6 months after their initial series. And that is for people who received Pfizer as their initial series. These groups of high-risk populations include people who are 65 years and older and residents in long-term care settings who received Pfizer initially, people aged 50 to 64 years with underlying medical conditions, and people aged 18 to 49 years with underlying medical conditions. So basically 18 to 64-year-olds with underlying medical conditions. And then people who are aged 18 to 64 years who are at increased risk for COVID-19 exposure and transmission because of their occupational or institutional setting. And it's important to note that if you already received a 3rd dose as being immunocompromised, then you should not get a booster. You don't need a 4th dose. You can talk to your medical provider for more information. It's also important to note that while the 3rd doses for immunocompromised were recommended for those who received Pfizer and Moderna for their initial series, these boosters have only been recommended so far for those who took the Pfizer initially. The FDA and CDC are currently evaluating the need for booster doses for those who received either the 2-dose series of Moderna or the single-shot Janssen vaccines. Lastly, I just want to restate the importance of vaccinations and masking. We've seen our vaccinations uptick lately as we approach a rate of 52% in the state who are eligible being completely vaccinated. And we've seen cases decline over the last couple of weeks. There are likely multiple contributing factors, but we know that vaccines and masks play a role. So we need to increase both as we look to finally end this pandemic. Thank you.
Thank you so much, Dr. Traxler. Now I'm going to go through our pre-submitted questions. The first question that we have today is, how does SCDHEC feel about the Ivermectin study being done by MUSC, and what do they hope it shows?
So DHEC appreciates the efforts of MUSC and any other health entities that are working on ways to stop the spread of COVID-19. We support properly designed and performed clinical trials such as this one. That said, it is important to remind people that ivermectin is not a drug for treating viruses per se, and it is not currently authorized for use in treating or preventing COVID-19. Ingesting large doses or the wrong formulation of this drug is dangerous and can cause serious harm.
Our next question is the Delta variant still the main one in the state? Which variant is most common now? Which one is causing the most hospitalization still? And have any of the other variants made their way here?
Okay. The Delta variant is still the most prevalent one that we're seeing statewide, likely due to its high level of transmissibility. We are not currently tracking the variants specifically among the severe COVID-19 cases, so we cannot confirm which variants are causing the most hospitalizations or deaths. That said, we do know that the number of increased cases that we have seen statewide and nationally this summer is mostly due to this Delta variant. All variants of concern outlined by the CDC are being tracked on our variant page on our website. And it's important to note that we know that there are more cases of all of these variants than what we're currently identifying via the randomly selected samples. The goal of our tracking is not to get a total count of every single variant case. Rather, is to study the virus through these samples to provide a picture to us of its impact on the state.
Thank you. Our next question is DHEC planning to do anything else to help encourage people to get vaccinated?
So we have several current and upcoming efforts to increase vaccinations. Currently, our homebound program is allowing providers to make house calls to vaccinate people who are unable to leave their residence. Additionally, we recently launched our mobile vaccine clinics, which are traveling to underserved communities across the state to provide vaccinations. We're continuing our outreach efforts by speaking to community leaders, faith organizations, and other entities, and we're continuing to use PSAs, radio ads, billboards, and other mediums to promote vaccinations. These and other efforts are, of course, in addition to the hundreds, literally, of vaccine clinics that are open every day for residents to come in and receive their free vaccine.
Our next question is anything we should keep in mind with COVID and cooler temperatures? How does the weather factor into the illness?
So as the weather cools off in the state, people will spend more time indoors. We know that being indoors is a higher risk for transmission than outdoors, and certainly more people crowding in an indoor space could lead to more spread of the virus. In addition, the cooler temperatures and indoor heating contribute to a lower humidity level, which does often enable the virus to remain viable for a longer time period. Lastly, people are more susceptible to respiratory viruses when they have dry mucous membranes, like in your nose or mouth, or even your eyes. And for all of these reasons, it's important that everyone eligible get fully vaccinated now before the weather cools off and these occur. In addition, with virus spread the level it is statewide, all people, both vaccinated and unvaccinated, should wear masks when they're indoors in public and around people who are from outside their own household.
Thank you. Our next question is, the report released Monday shows a big drop in the positivity rate, 8.3%. It had been as high as 17.5% on July 28th. What do you attribute that to?
So numbers are bound to fluctuate during a global pandemic, but there are some factors that may contribute to this lower positivity rate. For one, we have seen a slow but steady uptick in vaccinations in recent weeks. A drop in positivity could also be attributed to less people vacationing as summertime ends. Less vacationing means potentially fewer gatherings of unvaccinated people, which provides less of an opportunity for that virus to spread. That said, I don't think we should look at the last couple of weeks as a sign that things are good or are going to necessarily continue to improve. We must continue to increase our vaccination rates and continue wearing our masks for the time being in those public indoor settings.
Our next question is, please explain the formula for how the daily percent positive rates results are figured. Dividing the total number of positive cases by the total number of tests never seems to match the percentage on the report. Even if you add in the probable cases, it still doesn't add up.
Sure. So the daily percent positive is calculated using a test over test method. So meaning it's calculated, you take the number of positive molecular tests and you divide that by the total number of molecular tests for that given day, and then of course multiply by 100. So for example, on September 26th, we received 19,821 total molecular test results, and 2,172 of those were positive tests. So you divide the 2,172 by the 19,821 and then multiply by 100, and that gives you that percent positive of 11%.
Our next question, no math involved. Will we start to include booster shot data in our daily reports?
So we are currently providing the third dose data on the administration section of our vaccination dashboard. With the recent announcement of boosters, we are discussing internally how to best provide this data, either along with or combined with that third dose data.
Our next question is, where does the case count for both children and pregnant women stand in the state and specifically in the Lowcountry? What are their percentages of vaccination?
So DHEC is not regularly tracking this data for pregnant women. Among children, South Carolina has totaled 64,458 cases in those 0 to 10 years old, and 131,048 cases in those ages 11 through 20 years old since the start of the pandemic. And per our vaccine dashboard, 29% of South Carolina residents who are aged 12 to 19 years old have been vaccinated.
Our next question is, how many children are currently on ventilators or ECMO?
So DHEC does not track this information by age groups. We do know the South Carolina Children's Hospital Collaborative, the one that represents the 4 children's hospitals in the state, Prisma Health Children's Hospital in the upstate, McLeod Children's Hospital, MUSC Sean Jenkins Children's Hospital, and Prisma Health Children's Hospital in the Midlands, post their daily pediatric figures on its Facebook page. I'm not sure if they've posted today's data yet, but according to yesterday's numbers, there were 28 children hospitalized with COVID-19 among the 4 hospitals. 10, I believe, were in critical care. 6 were on ventilators, and I believe there was 1 child who was on ECMO.
All right, 2 more questions. One is, what is a message you would like to tell parents or pregnant women about the virus and its impact without a vaccine?
Sure. And the CDC, I believe, has just recently today issued a health alert advising on this very topic. For pregnant women, there is very strong evidence that women during and after pregnancy are at much greater risk for more severe illness from COVID-19 than other people in their age group, and are more likely to have major pregnancy complications due to the infection. So it is important for expecting mothers to get vaccinated as soon as possible to protect themselves and their babies. For parents, we strongly encourage you to get your children, age 12 and up currently, vaccinated so they can be protected in school and at events. Vaccinations not only protect children, but they protect immunocompromised or older residents who may be more susceptible to severe illness. And all eligible age groups can best protect our younger children who aren't yet eligible by getting vaccinated, since younger kids cannot protect themselves currently.
And our final pre-submitted question is, can people expect to feel some side effects from getting a booster shot?
So there have been no reports of new adverse effects noted from the third doses or boosters. The Pfizer booster is the same product and the same amount as the first 2 doses. And so any side effects experienced with the booster would be expected to be similar to the ones people may have experienced during their initial series.
All right, thank you, Dr. Traxler, for those answers. Before we open it up for live questions, I want to remind folks that the purpose of this briefing is to inform and educate the public on the status of COVID-19 in South Carolina and answer any questions you may have about it. Any requests or questions about issues other than COVID should go through our normal media relations channel at media@dhec.sc.gov. If you have a question, please raise your virtual hand and I'll recognize you. Out of fairness, I'll try to get to everyone interested in asking questions first before I come back for follow-ups. And I'd also add that a recording of today's briefing will be available later on this afternoon on our YouTube channel. First up for questions, I see Tina Terry. Please go ahead.
Good afternoon. This is Tina Terry with WSOC TV. Thanks for doing this. A recent report shows about 14,500 cases per 100,000 children in South Carolina testing positive for COVID-19. And it looks like that's the second highest rate in the nation behind Tennessee. What do you believe has contributed to those numbers, that high rate? And do you believe that would decline if mask mandates were implemented in local schools?
So we have seen high case rates among all age groups, unfortunately, in South Carolina this summer. And so that just as we have in adults, we have seen that same thing in children. A lot of that is likely due to the Delta variant becoming so predominant, becoming that predominant strain, as it is so much more transmissible than previous strains. And we certainly know that mask wearing and vaccinations significantly decrease the rate of spread of this virus.
Lynn McIntyre, go ahead, please.
You had to know I was here and would have a question. Dr. T, I have, and I'm sure all of my brethren on this call also have the comments from Governor McMaster and the Attorney General, both saying they expect to appeal yesterday's ruling as far as the U.S. Supreme Court. In the meantime, have you or do you anticipate sitting down or having a discussion with Molly Spearman and her people regarding any kind of updated advisory, guidance, or recommendation for local school districts?
So DHEC continues to stand by our guidance that we know masks work, especially in indoor settings that are maybe more crowded or where social distancing is more difficult, or certainly around people from outside your household. So we stand by the guidance that we have put out.
Judy Goddard, go ahead, please, ma'am.
Thank you so much. I actually wanted to follow up on Dana Lynn's question and with a specific focus on a mask mandate, because as you have talked about this before, and Dr. Simmer and other folks with DHEC, it was clear that DHEC was urging that the proviso be repealed, and we wanted to make it clear that a mask mandate would be effective in slowing the spread among children, especially with the increase in cases that we're seeing. But the statement was that it would be difficult to enforce because of the proviso. So in light of this federal ruling, is DHEC going to consider now enforcing a specific mask mandate for schools?
I would say that, again, it's in terms of anything legal, it's kind of inappropriate to comment further, as it is a legal matter involving other state entities. And I think as was mentioned, there may be appeals. I will say that DHEC does continue to stand by our guidance and our message that we know masks work and that mask mandates are effective at lowering the spread of virus.
Thank you, Judy. Anybody else have any further questions today? Seeing none, I want to thank Dr. Traxler for your time today and all of the media present for your valuable time and continued coverage of the COVID-19 pandemic in South Carolina. Take care of yourselves and be well.
Hi, sorry, before we go, Dr. Traxler, could you provide the links of the two studies you mentioned at the beginning of the briefing?
Yes. Give me 1 moment to grab them and I'll put them in the chat section.
Thank you so much.
Mm-hmm. You're talking about the CDC studies, correct?
Yes.
Yes. Let's- Okay, I found one link, it's the press release about the 3 studies. And that links actually to the reports from this one press release.